slides and more like a presentation with slides. So if you are able to put on your video, we would greatly appreciate it because we're having kind of more of a conversation today. Welcome. Just maybe a minute more.
And hi, everybody. If you could introduce yourselves in chat, that would be great. Especially if you're joined by others in the room and there are multiple of you there. I'm not sure if anybody is, but if you are.
Every time I think, oh, let's get started, then a couple more people pop up. So I keep on just waiting just a minute. I know one of our speakers is not on yet. So Francois. As we're getting ready to start here, again, if you can put on your video for this session, that would be wonderful. Also introduce yourself in the chat box. And what do you guys think? Should we get going?
I think so, Karen. Just to stay on time.
Okay, well, let's do that. All right, well, welcome everyone again. Thanks for joining this session of the ICCP ECHO. We are rounding out, if you can believe this, almost a full year of these sessions, and our next two sessions, September and October, are going to be focused on hearing from all of our teams on their progress for their implementation priorities that they selected about a year ago. And as you all know, we gave you a scenario, which we think could be even a real life scenario. And it really makes you think about what have you done that you can communicate well to others about not only your priorities, but moving forward in the kind of assistance and support that you would need from other folks. So just to remind everyone, what we have is we have this scenario. You're sharing a taxi with the Minister of Health on your way to a meeting, and the minister asks you, I remember you and other cancer experts participated in a year-long ECHO on implementing our country's national cancer plan. What have you been able to accomplish over the last year, and what do you need to keep the momentum going? So that's what we're asking people to respond to. We've asked that people keep that to a 5-minute limit and no slides. We're not going to have any slides today. The order of presentations, so heads up for those of you that are presenting today, we'll have India, Cameroon, and Rwanda. After each of your 5-minute presentations, we'll have a Q&A period. So as you're listening to another country's presentation, if you have questions, please put them in the chat, or after they've presented their scenario, then we will have a discussion. And then at the end of all 3 presentations today, then we'll have more of a full group discussion and ask you a few questions about your experience with the ICCP ECHO overall. So if that makes sense to everyone, hopefully it does. Leslie, I'll turn it over to you to call on the first presenter.
Great, thank you. I get to play the Minister of Health today, which is fabulous. I've always wanted to be a Minister of Health. So We're going to start with you, Dr. Suzanne, if you could come off mute and share. So we are in a taxi together. And so tell me, I hear you've been working on this in this ECHO for the last year on the National Cancer Plan. What have you been able to accomplish?
Hello, good morning, good evening, everyone. So that was a surprise scenario though, but nonetheless, yes. So talking about the progress since we started with the ECHO, ICCP ECHO sessions. So one of our primary focuses has been capacity building. When we talk about our ECHO hub in India, and we have done pretty well on that front. And just to probably reiterate and briefly describe our program. So we have online virtual programs for cancer screening training for healthcare providers, which involves all sorts of healthcare providers, starting from general physicians, that is, the medical officers working across various healthcare settings in India. Then we also have a specialist program for dental specialists and gynecologists. And then uh, towards the later part of last year, we also began with our nurses training program. So these programs are basically hybrid, if I may say so, because after the virtual programs, which last over up to 14 to 15 weeks, depending on the type of program designed, we also have in-person training workshops for these healthcare providers to sort of give them a practical hands-on experience of whatever is being taught in theory during the online training programs. And so far, we've been able to train more than over 1,000 medical officers, then almost above 250 dentists, gynecologists, and nurses. And we hope to continue this in future as well. And I'm sure it has been mentioned in one of the sessions earlier that our hub has been designated as a training center by the Ministry of Health and Family Welfare, Government of India. So that has been, I mean, that's been a big boost to the program. Then the second focus for us was, of course, cancer screening. Um, so in general, because of the COVID condition, the COVID pandemic, it did come to a halt for a significantly long period of time. But gradually now things are, I won't say resuming to normal, but yes, things are picking up again. And hopefully in the near future, things should gradually come back to normal as well with regard to cancer screening. And another part of cancer treatment, um, which of course, again, had to halt in between due to the COVID pandemic. So, however, a number of hospitals, and to name a few, uh, um, large medical institutions or hospitals in New Delhi, for example, like the All India Institute of Medical Sciences, they continued with their health, their medical health through the teleconsultation feature. So that is the mode they got involved in to to provide follow up to their patients who were already registered with them, to the cancer patients who were already registered with them. And even for future consultation, one could contact the doctors through this telemedicine, teleconsultation mode. So that has been progress on the uh, cancer treatment or cancer management front. Then, apart from this, excuse me, um, we all, with regard to publications, yes, we did submit a paper on the date out, the findings from almost 7 to 8 training programs of medical officers, which we had conducted earlier, to sort of publish our findings on the effect of these programs on the medical officers, the primary healthcare center physicians, and it is in review at the moment. And we've recently, in fact, worked on the revision and we hope to have it accepted in the near future as well. Another part that I would like to mention here, it may not be directly related to only our organization, but yes, it's an important part of the entire National Cancer Control Plan, is the initiative to sort of um, take ahead the partnership building among the various cancer centers across the country. So the National Cancer Grid that was formulated in around 2012 in India, with about 60 institutions at first, has now grown to almost a chain of 200 cancer centers across India, which are involved in not only cancer research, but also developing evidence-based guidelines for cancer treatment on different cancers, that is. And this is also found on their website as well. So this is a good progress when it comes to intercollaborative work, not only for research purposes, but also for cancer management and screening. And we hope that this goes ahead a long way, especially because we're talking in the context of cancer screening. So we hope things even improve on that front. And of course, one challenge probably would be the funding opportunities when it comes to cancer screening projects or cancer screening initiatives, which is on the lower side right now. So we hope that there are more opportunities on that front in the future. So that was an update from my end. And I have one more teammate from India here. So if anybody has any questions, please feel free to ask. Thank you.
Thank you. Thank you so much, Suzanne. We only have just another minute or two together, but I wanted to ask you, what would it take to keep the momentum going? You've done so much, you and the team, over the last year, despite COVID-19 and the shutdown. So what would it take to keep momentum going with implementation of the plan?
Yes. So one advantage of having a virtual mode of training is that it can definitely be continued with the same momentum as it was being conducted earlier during the pre-pandemic era, if I must call it that. Of course, maybe the in-person training may not be possible for some more time, but maybe in the near future. But yes, I think the online training capacity building can definitely go with the same momentum, and that's what we hope to build on as well.
Thank you so much.
Yeah, thank you.
Yeah. I want to stop here and say thank you so much to the India team for your participation. It's great progress on all the priorities that you identified. So wanted to see if anybody has any questions for Suzanne. Okay, if you do think of one, please put it into chat. And if you're just joining us now, please introduce yourself in the chat so we know you're here. And for those of you who are joining just now, we are putting out a scenario, which Karen just put into the chat, about being in a situation to tell the Minister of Health in your country about what you've been doing in this ECHO over the last 12 months almost, and what your progress has been on your priorities. So we will move now to talk with Dr. Sona in Cameroon. I see you there.
Yeah, thank you. Good day to everyone.
Please go ahead. Tell us what you've been able to work on in your priorities over the last 12 months.
Thank you very much. So just a quick reminder that by the time we joined the ICCP ECHO, we had two priorities from our NCCP, prevention and palliative care. So as far as prevention is concerned, from the specific objective number 2 of our National Cancer Control Plan, our NCCP, it says that by 2024, increase primary prevention interventions by 25% through communication for behavior change in favor of cancer control. So what have we been able to do in the past 1 year? The progress we've made in this NCCP is that firstly, in collaboration with the United Nations Population Fund, sensitization tools for cervical and breast cancer were elaborated and validated by experts from both the Ministry of Health and Communication, which is now being used throughout the national territory. Also, these tools were successfully tested in some pilot areas in the central region of Cameroon. Precisely, we have Bafia, Obala, Ntui, and Njikini-Miki. Some gynecologists, general practitioners, public health experts, and public health and communication experts, nurses and midwives, have equally been trained on how to effectively use these tools in the community. And also in collaboration with some technical partners like Cameroon Baptist Convention Health Services and some civil society organizations like, for example, Humanity at Heart International, mass breast and cervical cancer awareness have been carried out in the central region, the littoral, northwest, and part of southwest regions. That is concerning awareness or sensitization. Now for screening, from our specific objective number 2 of our NCCP, it says that by 2024, increase by 25% the number of cancers detected and treated early. So in that light, a guide for screening and treatment for precancerous lesions for cervical and breast cancer was equally elaborated, validated, and tested in these same pilot areas in the central region. And equally, so gynecologists, general practitioners, midwives, and some nurses from 10 different regions were trained on cervical and breast cancer screening using clinical breast examination and visual inspection using acetic acid and Lugol iodine, respectively, and how to do treatment using thermal ablation. And immediately after this training, they were given instruction on how to effectively start the screening in their various health institutions. Immediately, they go back. So 4 centers for cervical cancer and treatment of precancerous lesions to screen of 5,000 women within 2 years were opened in 2 towns, Yaoundé and Akonolinga. We had 3 in Yaoundé and 1 in Akonolinga. This was done in collaboration with International Agency for Research on Cancer. And in this slide, we have 15 general practitioners, nurses, and midwives who were trained to carry out this screening in this project. And the National Cancer Control Committee has been working in close collaboration to carry out mass screening and treatment of precancerous lesions for cervical and breast cancer in certain parts of the country. You have the littoral, the northwest, the extreme north of the littoral, the northwest, and the extreme north of Cameroon. This has been done thanks to the assistance from the Cameroon Baptist Health Institution. And what are we planning to keep? What are we going to do to keep this this progress in continuous movement? We plan to continue advocacy. To do advocacy will be done at the level of the Ministry of Health and other financial partners to enable more of these tools that have been elaborated and validated to be printed, and training of more health personnel on how to use this tool to be done. We equally plan to do effective follow-up, effective follow-up for all what this sensitization and screening. For it to be done, we need data. So that is why we plan that all the activities that we carry out in these different parts of Cameroon for sensitization and screening should be sent to the National Cancer Control Committee. It is from then that we can know the progress and take a better decision in the future. We are going to advocate to create a network of civil society organization, because this is going to help to carry out this awareness to do more effective sensitization. And equally, advocacy will be done to provide HPV machine. You know, our screening in Cameroon, it's true that some places are using HPV machine, but some are limited to via-VLE. You know, WHO is encouraging people to use HPV. So we are going to advocate on how this machine can be used, provided in these different screening centers. And now we focus more on clinical breast examination for breast cancer screening. So we will continue advocacy to make sure that mammographs will be provided to these different health screening centers to improve the quality of screening. That was for prevention. For palliative care, I want to remind you again that the specific objective number 4 of our NCCP says that by 2024, improve the effectiveness and efficacy of treatment with a 10% increase in the overall cure rates. And the priority intervention number 2 says creation of appropriate palliative care services. So we have been able to elaborate a guideline for palliative care in Cameroon. But the validation is still pending, because we are still advocating for funds on how NCCP can call the different experts and validate this guideline. And also in collaboration with Cameroon Pediatric Oncology Group, is an NGO in Cameroon, some nurses and doctors were trained on palliative care of pediatric cancer patients. So what are we going to do to keep this plan moving? We plan to continue with advocacy to get funds to validate the palliative care guide, and also to train more health personnel on palliative care. And lastly, to advocate for constant supply of palliative care drugs like morphine, which is a serious problem presently in Cameroon. So thank you very much. So far, that is what we have been able to do the past since we joined the ICCP ECHO. Thank you so much.
Thank you, Dr. Sona. You've done so much, you and the Cameroon team. It's really impressive. If I were the Minister of Health in Cameroon, I would make sure I would advocate for all the things that you talked about. Thank you so much. Anyone have any questions for Sona? Karen, do you have a question?
Karen?
Yes.
Is that what you said? Okay, sorry. I didn't know. Well, I put in the chat. I was just trying to maybe jog people's thinking about what kind of piqued your interest when you were hearing about Cameroon's progress and future plans. And so, you know, one thing that you said is so important, and I liked about the data that you're collecting and all being sent to the Cancer Control Partnership or program. Was that a system you had to set up, or was that an existing system that you expanded or included then cervical cancer information? Did you have to start that up, or did you have something that you built upon to get that data? Sona, that's a question for you, Sona.
Yes, thank you very much. You know, Cameroon used to have, there was an existing a population-based cancer registry that existed up till 2012, and because of one reason or the other, that registry stopped existing. So, because of the advocacy that we have done, the minister has signed authorizing a new cancer population-based cancer registry in Yaoundé and Douala for a start. So we are happy, even though the effective implementation has not yet gone fully. That they have already appointed these officials that will be working in this cancer registry. Their offices are already provided and equipped. They started already collecting this data. But since as we are focusing on prevention, we want to really get a complete data, especially on screening and sensitization. That is why all those that were trained, we equally, with the authorization from the Executive Secretary of the National Cancer Control Committee, we elaborated a different data sheet that will be given to these different treatment centers. And they have our contacts. And at the end of every month, as from the end of this September, we'll be writing them, and if possible, visiting some of them to encourage them to send this data and to make them to know the importance of this data, because it's only when we have this data that we will know what is being done correctly, what is needed to be done, or what is not done well. So that is what we plan to do concerning the data on prevention.
That's wonderful. Thank you.
Thanks so much. And Kalina, I see you have your hand raised to ask a question.
Yeah, I think Mishka actually had hers up before me.
Oh, I'm
so-
sorry, Mishka, I didn't see.
No problem. So this would be a question for, and this might actually be a question for all three teams, based on, I haven't heard what Dr. Francois has to say yet, but it seems like you're doing a lot of really good foundational work to understand what works on the ground by some of these like pilot activities or activities in building the structures in place, and understanding that, you know, there's this idea of scaling up, but that's not so easy. And it really might not be like necessarily the right way to go, because each facility or each scenario might be quite different. So I'm curious if when you're talking in your teams, what are some of the challenges that you are discussing in terms of, okay, if we sort of have this proof of concept that this works in this facility or this scenario, how do we adapt elsewhere given the resources that we have? So I don't know if that's a question you've been dealing with, and sort of, you know, again, if you had to ask the Minister of Health for support in that area, what, or maybe a different ministry, what would that question be or request? So that would be to Sona and I think Kavita, because I think Suzanne had to leave.
Okay, thank you, Mishka. This is Dr. Kavita from India team. If I understood the question right, is it you are asking about the challenges? How do we, you know, overcome the challenges what we had during this period, right? During the training period, with in respect to the, you know, the priorities what we had. Am I right? Okay.
Yes.
So, you know, like how we mentioned, one of our primary priorities is to develop the, you know, improve the capacity building. Actually, this COVID situation has been, you know, gift in this aspect, because our training program is both, you know, online and offline hands-on training. And before this COVID era, many were not that, you know, equipped to handle the online sessions, but this COVID had given us more opportunities to explore this platform. So we have tried and strengthened our this capacity building, and we have improved, you know, included more courses on capacity building in the state level also. So in all cadres, you know, the nursing cadre and medical officers and gynecologist cadre. So this part has been, you know, not challenged, but as an advantage, I have to tell. The other thing is that, you know, screening itself, going to the community, motivating, creating awareness was a challenge. But now we have introduced the contactless self-sample collection of HPV DNA testing. So that had, you know, improved a bit now. It is picking up in our institute so that, you know, we can, you know, start and not to the normal level, but still it is picking up. So these are the challenges to bring the number of screening into the normal, like before the COVID era is the challenge, but I hope it is not only for us, it is for the whole world. So at some point of time, we all will, you know, get back to the normal state. Thank you.
Thank you, Dr. Kavita. Kalina, do you still have a question or?
For Cameroon, you know,
Oh, go ahead.
the major challenges that we have been facing is, you know, being a low medium income country. More focus is being placed on infectious diseases. So even though data is showing that cancer is really a public health problem, the decision makers do not really see it in their head, as they don't prioritize this disease as one of the most important in this country. So that is why if we have the opportunity to meet with the minister, we need to help to wish to make him to understand that cancer is really a major problem, and if it can be seen as a priority disease in Cameroon, is going to be helpful. Secondly, there is nothing you can do without funds. We have the will, but to put all of these ideas in place, we need some funds to push through. So if we can have opportunity to make the ministry to put in more funds in the National Cancer Control Committee, so that it will enable this committee to carry out its activities smoothly, it will be helpful. Another thing is the delay in administrative procedure. There are times that you want to do something, maybe next week, you need authorization from the minister, and he may give you that authorization only after that date. So some of this slow administrative procedure is another challenge that we are having, that we really wish to really, if changes can be done in this direction, it would be helpful. So those are some of the challenges are enormous, but these are some that I can really enumerate to you this evening.
Thank you, Dr. Sona. I think, Kalina, we'll take one question from you, and then we'll ask Dr. Francois to share with us.
Yeah, thanks, Leslie. And actually, my question was very similar to Mishka's, so great minds will claim on that. But Dr. Sona, in your presentation, it caught my attention, the sort of shift to HPV screening for cervical cancer. And so wanted to sort of ask what you would say to the minister was needed to sort of make that shift and scale that. So I think it's probably a relatively similar question and answer. So maybe we can save that one if it makes sense for later.
Sure, that's good. So yeah, let's move on to Dr. Francois from Rwanda. Dr. Francois, same scenario to you. You're luckily in a taxi with the Minister of Health. And he or she asks you if what you've been doing for the last year in this ICCP ECHO, and what progress you've made on the National Cancer Control Plan. So please share with us. Francois, you're on mute.
Hello, can you hear me?
Yes, please, go ahead.
Okay, thank you so much. So, where to start? So I think I would, let's say, I'm talking to my Minister of Health. So just telling her what we managed to achieve over the last year, and also the benefits of attending these ICCP ECHO sessions. And I guess these are great platforms that, helped us to understand on how to go with the implementation of our National Cancer Control Plan. It was a great platform that helped us to be connected with other cancer experts or cancer leaders from other countries with a similar, let's say, the same settings, if I can say. Most of our participants were from African countries, Asia, with similar issues, with similar resources. It was a very enriching, let's say, experience. So with regard to the implementation, I would say that, of course, we planned a lot, but with COVID-19 pandemic, some of the activities were not implemented as planned. But of course, we pushed a lot because, COVID is COVID, it's a pandemic, but all those other services are now depending on COVID situation in the country. But we pushed to do some, let's say, some progress regarding the implementation of our cancer control plan. I will just focus on maybe few significant achievement. So Rwanda has pledged to be among those, top countries that will reach the global strategy for cervical cancer elimination. So over this year, we managed to scale up cervical cancer screening services into 4 additional districts, covering 67 health facilities. And in those facilities, we are now using, this new recommended cervical cancer screening strategy by the WHO HPV DNA test. But of course, it's not easy because, our tests, our HPV tests are competing with those other tests, mainly HIV viral load, hepatitis, because we are sharing the machines. But of course, we push and then we managed to screen, I think, so far this year, we managed to screen around, 43,000 women. So the numbers are still low compared to our targets, but at least we managed to make some progress. And even we improved the MNE, let's say the data capturing of our cervical cancer screening program, because we have now digitalized our cervical screening forms. So now we are using tablets through OpenMRS, so that now, we are no longer using papers, and then we can now, even here at the center level, be able to see what health facilities are doing. So for the treatment, it was also really a big challenge, because once you invest more in screening of different cancers, we should also make sure that we have got the treatment services ready to manage those cases that we might be identifying during the screening. So here we can say that we managed, together with other stakeholders, with our clinicians, with our technical working group, to have our first national cancer treatment guidelines. For Rwanda, based of course on different guidelines. So based on ASCO, based on NCCN guidelines, and then we managed to summarize them and come up with our own guidelines. And then, so we can also be proud that, we are launching, I think, in 2 months, from now, October, our local training fellowship program for our gyne oncologists, because, it was a very, very big gap in the country, and then now we have now the curriculum ready. The University of Rwanda has approved. Now you have 2 experts that we have hired to lead the program, and then I think everything is ready now to kick off our own local training program to be able to produce our own gyne oncologists. So again, for human resources also we progressed a lot. So we managed to have our 4 medical physicists graduated. They are now providing services at our cancer center. Making treatment plans for our patients in need of radiotherapy. We have 2 additional medical oncologists, and then 1 clinical oncologist that has also recently graduated from Tanzania. So regarding research, monitoring, and evaluation of what we are doing, so with our cancer registry, we managed to improve. We managed to link DHS2 with candidate 5, and now facilities can now send their data through DHS2, and then we can now be able to export data to our candidate 5. This has helped a lot to save money for active data collection, sending cancer registrars at facility level to collect data and come to do manual data entry, and now we can get data from facilities, and then maybe work with them to fix some quality issues that we can see. So we're happy to tell you that now we are also, we have finalized 2 papers. One describing cancer epidemiology in the country, and also the other one also is also focusing on this process that you have gone through regarding scaling up cervical cancer screening services in the country. So we are ready to submit them to peer-reviewed journals for publication. So I think it's also another thing that we can mention here, to be able to communicate to the global community what we are doing. Lastly, I cannot also miss to say, over this last year, we managed to mobilize additional funding for our cancer control activities. Now we have got 2 additional memorandum of understanding with 2 new organizations that are helping us to implement different activities. So, and these are the grants that really will make a significant change in our cancer management landscape, or cancer control landscape. I cannot finish without mentioning that we're also working on a big private public partnership project. We're working just in so very, very promising. Probably in 6 months, we should have the contract ready to build a comprehensive cancer center in the country with even some very advanced treatment, diagnosis modalities like PET scans. So I think these are things that will really improve a lot on what we are doing and also help us to reduce cancer-related mortality in the country, which is the goal of our cancer control plan. Thank you, Honorable Minister. Thank you.
Thank you, Dr. Francois. So one thing I would ask you is to help keep this going, all of the great things that you've accomplished, what's the one thing that you need from me?
Thank you so much, Honorable Minister Esri. And I think here I can say, yes, we thank you so much for your support. So I think without your leadership, we're not able to achieve this. But what we need mainly from you is to see how we can together make advocacy, make a case to be able to increase domestic funding for cancer prevention and control activities. Because if you look at what we do, we are heavily relying on external support. So, and I think it's time also to see how we can have, let's say, our domestic funding also increased, and also help us again to streamline, to mainstream mainly cancer prevention in the other different institutions here in the country, because we are seeing that the Ministry of Health, with other few local organizations, we are doing a lot, but we need also to have those other ministries, public institutions, even private institutions, be heavily involved. Lastly, I would say that yes, with COVID, we are seeing that external funding is decreasing significantly. Even some partners that made some pledges have withdrawn those pledges. I think it's time to see how we can now even start approaching wisely our local private entities, companies, to see if they cannot also help us doing, funding some cancer control activities. Thank you.
That's a great response, Francois. Thank you so much. Anyone have questions for Dr. Francois or comments you'd like to make? And Lisha, I think we answered your question about treatment very well. Anyone have other questions you'd like to ask? Doug, please go ahead.
So hi, everyone. First of all, I just wanted to congratulate the three presenters and the teams. I think, you described great progress in the implementation of your national cancer control plans. I think you covered several themes that were discussed throughout the year. The idea of increasing the workforce and infrastructure in your setting, in your country, the access to services as well, increasing availability and access to service. The idea of capturing the data that will inform like the progress of the implementation of your plan. So I think there's all these great things that we're capturing in the presentations. And I would just have like a question regarding, because also it's great to hear like all this progress during a very challenging time with COVID-19, and you all mentioned that, of course. So I was just wondering from, the three teams, that at some point did you have to revisit your plans and your goals, and the idea that, this very unexpected event happened, and then you had to adapt to the situation. Like how did that happen in your setting, in your country, when you were going through the implementation of your plan? Thank you.
Thank you, Doug. Anyone want to respond? I think we heard from Kavita about adaptations and how the pandemic was a bit of a gift in terms of people being able to access online training. Anybody else want to talk about adaptation due to the pandemic?
Maybe if you allow me, I can say something. Definitely we need to And even so, I was even saying that maybe beginning of next year, we need to see how we can do a mid-term review of our cancer control plan to see what we managed to achieve and what we didn't, and see if we need again to keep the same strategies or change depending, of course, because this COVID-19 pandemic is changing everything. So all our programs are depending on it. So if it's controlled, yes, we can move forward. But we know that tomorrow it's a lockdown and nothing's being done. We are all deployed to provide like support in COVID-19 response. So to me, I'm seeing that the targets should be revisited, because we're too ambitious in our cancer control plan, saying that maybe by 2024 we should have achieved those targets that we have in a cervical cancer elimination strategy, especially for the screening. So, but if you look at where we are now, we are around 12%. If you look at those women eligible for cervical cancer screening, and those ones that we have screened so far, we are really very, very far from the target. So meaning that, again, we need to see a realistic target, a realistic number, taking into account all these issues that we have said, so and be able now to set maybe a new target which is probably realistic, which even might be half of 70. I mean, that is 70%. This is something that I think here we can say. So there are many things that really should be revised. You know, there are those trainings. You know, people cannot gather in one room and connect all those trainings. Some will be deferred, some will be delayed. So can we change some of those into online trainings? So these are things I think everybody should look at and see if we need to continue doing the business as usual or if we need to change. So thank you.
Thank you, Dr. Francois. I think that's where everyone is and should be thinking about adjusting those kinds of targets. Absolutely. And just how you want to adjust your approach, because I don't think we're out of the pandemic quite yet, so it's still continuing. Anything, Dr. Sona, that you want to add about adaptations or changes as a result of the COVID pandemic around your cancer control plan implementation? Is he still there? No. Oh, no, I don't see him anymore. Oh, I think he dropped off. Sorry. Okay, well, hopefully we'll hear from more from him later. Thank you. So any questions from anyone right now that you want to ask any of the countries who have presented? Feel free to come off mute, or you can put your question in chat. Lucia, do you want to ask your question?
Sure, I can ask it. That's fine. I'm just curious if anyone, thank you for sharing all of your work, and I'll just echo to say that it's amazing how much you've been able to accomplish in this really challenging time. So I'm wondering how, when thinking about the prevention side of things, in addition to the screening, how the HPV vaccination efforts in your countries are going in light of all the challenges with COVID, or if that's something you've even been able to think about.
Thanks, and I would welcome any of the countries here to answer.
Yeah, thank you, Lissy, for the question. In India, still HPV vaccination is not in the national immunization program. Health is a state matter in India. So till now, only state of Sikkim has, included HPV vaccination in the universal immunization program. I am not much aware of, into the state affairs, but we all know, brief about what's happening. So with that info, I would like to add. So like other, screening programs, this vaccination also got, little bit of hitch, but it's still, they're picking up slowly. They didn't stop though. They have, because the schools were closed and so many things which had happened, so they have to stop for a while, and it is picking up. So thank you.
Thank you, Dr. Kavita. Anyone else want to answer the question about impacts on HPV vaccination?
Yeah, I can also share, something, the situation here, because since 2011, when we started the nationwide HPV vaccination, we've been recording very, very high coverage rates. So since that time, we've been always over 93%. So, but during the pandemic, we dropped that around 77%. Because our HPV vaccination is school-based vaccination, and throughout the last year, schools were closed, and we tried to maybe to go down at the village level. So that we can ask women to bring their girls to be vaccinated, but we didn't manage, of course, to capture or to have some everybody. That's where now we are now having a catch-up plan to vaccinate those ones that we missed, because now schools are now open again. So this is to say that really there has been an impact on HPV vaccination program, because we were not able to have girls to be vaccinated because schools were closed.
Yeah, thank you. Thank you, Dr. Francois. Well, I think, Karen, you've put a question into the chat. We want to wrap this discussion up right now. Thank you all so much for your presentations. It was very, very helpful to hear your progress and how you've addressed challenges too.
Yes, thank you so much, everybody. Really appreciate it. Next month, Mishka will talk about that we're going to do a similar session. But as we kind of wrap up this first year, we're always looking, as you guys know, we're always asking you questions about how the session went and doing surveys, and we want to improve this ICCP ECHO as much as possible and make it really relevant to the participants. So you can see in the chat that we've put a question about if you had to give advice to the next cohort coming in, which is going to be about 3 to 5 new countries, as you give them, what advice would you give them as they come in? What would be most helpful that maybe you wished you would have thought about before this ECHO, participating in this ECHO, or things now that you've gone through almost a year that were helpful for you? And again, it doesn't have to be anything very, monumentous, but just we would like to get some feedback from you about what would be helpful to the next cohort coming in. Then with that, and if anybody wants to come off mute and say something, really, that would be wonderful. And Francois, I see we have 1 or 2 projects to concentrate on and find out the way to monitor the progress and be able to present here how the implementation is going on. So kind of that focus, it sounds like. We always say at the beginning of any kind of implementation of your cancer plan, it's so hard because obviously cancer plans are very large. And so where are your priorities? Where can you focus and get support around and get partners to help with implementation? So certainly, I think we would agree with that kind of focused approach. So we have a couple last comments from Lindsay and Mishka, but as again, we're wrapping up here, please, if anyone else has some ideas about advice for the next cohort, please put them in the chat. Again, that would be very helpful to us. Thank you. So Lindsay, I'll have you talk about kind of some key things that we've got going on evaluation wise.
Yeah, so we'll just finish today with a post-session poll, and I know it's a little different today, but we've got 2 questions for you. One, how likely are you to use the information presented today? So how likely, are you to use the information that you heard from these team leads on the progress they've made and sort of challenges and lessons learned? And then 2, just your overall satisfaction with this session. And that's it for me.
All right, and I will just close out to say that please feel free to join in on the Basecamp portal and share more information there or additional questions. And also we will have our next session next October, on October 13th, same time, and the countries presenting to their Minister of Health will be Kenya, Malawi, Nigeria, Eswatini, and Tanzania. So thank you very much. I'm just sticking the Basecamp link in the chat, and that's it.
All right, thanks everyone. I think we'll leave the chat open just for a second here. If anybody else has some comments they want to put in the chat. Anything else before we sign off that anyone wants to say or comment on? And we're going to ask the same question next session about advice that you would give to the next cohort. So you can be kind of thinking about that. And one thing in particular, and understandably, sometimes bandwidth and just whatever, we don't get quite the discussion that we might want, or have you guys ask questions of each other. So if there's anything that you can think of as well that can kind of help that interaction, we'd love to get some ideas from you regarding that as well.
Karen, can I just speak for a minute? This is Dr.
Please. Please.
Yeah. So I just saw a text from Dr. Francois. He was mentioning that, many of the countries who were part of this program in the beginning had dropped out and they should be motivated. I agree with him completely. The main idea of us joining this program was to, to know and understand how all other countries are handling this difficult task of cancer screening, this program. But now at present we have left with let's say 5 or 6 countries only attending this program. I think you should ask and understand what is the reason that they have dropped out. Maybe in the next coming cohorts it will be very helpful for you to to get inputs from the other countries which are successfully running the program. Maybe one country's success can be the other country's challenge. So we both, countries can help each other to build a stronger program. So that can be done as a part of your, next cohort. Thank you.
Thank you. And those words are exactly right. One country's challenge can be another country's success. And so again, this dynamic of talking and sharing with each other is so critical to learn from each other. So we appreciate those comments, and I think it's a good idea. We'll loop back to some of the folks that have dropped off to ask them the reasons for that and see if we can do anything about that. All right, well, if no other comments, then I do think we are done, and we will see you October 13th and hear from the remaining countries. Appreciate you guys being on today's call.
Thank you, everyone.
Thank you.
Hi, everybody.
Bye-bye.
Thank you.
Thank you. Bye-bye.